Namaste. The factors or causes behind diabetes are all well known, and one of the most common one is family history. But factually, the most common trigger is unmanaged stress and anxiety. When we are continuously stressed or anxious, we are in fight or flight mode, which means our brain signals to release adrenaline, cortisol, and noradrenaline into the bloodstream, resulting to which respiratory rate increases. These hormones then make it difficult for the insulin to work properly, and thus an increase in blood glucose levels can be noticed during continuous difficult or negative emotions like stress, unresolved anger, fear, or anxiety, leading to the manifestation of severe psychosomatic diseases, not only diabetes. When we are stressed, our muscles are tensed, and that is why even our muscles fail to absorb the glucose. Moreover, stress can cause us tunnel vision and hand tremors too. When we are going through difficult or negative emotions, the parasympathetic nervous system gets affected and all the related neurotransmitters function low too. The poor functioning of parasympathetic nervous system, amongst other physiological functions, also results in poor functioning of our digestion, sweating, blood pressure, urination, and salivation. Mental exhaustion wears us down at the physical level too. We end up overeating, stress eating, late night binging, or irregular sleep. If and only we start working on our stress levels, a lot of diseases can be averted, and diabetes too. Once we have diabetes, it becomes a vicious circle of poor physical health and mental health. Often, a lot of people have been seen fighting diabetes through strenuous exercises. While doing so, what gets ignored is that when we do heavy exercising, we put ourselves into the fight and flight mode. That is, our sympathetic nervous system acts out and causes us more harm than any good. That is why, to deal with diabetes, using a holistic approach, that is through yoga, is the most effective way to prevent, manage, or reverse disease. At psychological level, yoga practice would help in enhancing self-awareness, which is the greatest tool to be mindful of our state of mind. Reduction of stress is a sure shot to manage the sugar levels in the blood. Emotional restructuring is very much possible through regular yoga practice. At physiological level, the asanas shown in this video, this very simple asanas, can help the vital organs of the body to function properly that could maintain appropriate sugar levels. If you will practice the asanas as shown in this video on regular basis, you will experience a good stimulation of your abdominal organs, which will in return help lower your blood sugar, improve circulation, and improve insulin sensitivity, along with better digestion. But please do not practice without consulting a certified yoga therapist or endocrinologist. Remember not to exert yourself while doing any asana, as tiredness may lead to hypoglycemia. If you are a beginner in asana practice, feel free to use props like walls, bricks, chair, yoga strap, wheel, etc. for getting the right support. In breathing exercises, try practicing equal breathing pranayam, nadi shodhan, and brahmari pranayam. Along with all that, please ensure to eat right and healthy and work on your thought process by learning to work on your mind. Tell yourself every day, you are not your thoughts. Namaste.